Welcome everyone, I'm Reem Hussein, Chief Planning Officer at Azzad Asset Management, and today we're going to talk about Medicare basics. I'm confident you will benefit from the information we provide you today, but first let's get the disclaimers out of the way. This presentation is not meant as one-size-fits-all investment advice or any account type or recommendation for any particular security. We highly recommend that you speak with your financial advisor, tax professional, or attorney for information specific to your situation. Okay, let's begin with the most basic of basics. What is Medicare? So Medicare is the national health insurance program for people 65 and above, administered by the Centers of Medicare and Medicaid Services, and enrollment through the Social Security Administration. So everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. However, our discussion today will pertain to the first group, people over 65. So Medicare is divided into 4 parts. Part A covers part of the cost of hospitalizations. Part B covers part of the cost of medical services such as doctor visits, procedures, and diagnostic tests. The bills for Part A and B are paid by Medicare. Part C and D are where the private insurance comes in. So Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Parts A and B and usually prescription drug coverage as well through the plan. And instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is the prescription drug coverage. It is offered by private insurers who contract with Medicare. And each prescription drug plan is slightly different, which is why you want to shop carefully for your drug plan. And even if you do not take any prescription drug when you first go into Medicare, you will want to sign up for Part D because if you go without drug coverage for a very long time, you will face penalty when you finally do enroll. This image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Part A and B, then you decide if you want prescription drug coverage under Part D. This shows drug coverage as optional, but it can be dangerous to go without drug coverage. So we are recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of Medicare. And step 3, you decide if you want supplement coverage. Again, Medicare shows this is optional, but we think it's pretty important because Medicare leaves too many gaps. The second way to get Medicare is through the Medicare Advantage plan offered by a private insurance company. There are many companies in this area offering Medicare Advantage plans, so if you go this route, it will be important to shop for plans and find one that meets your needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. Choosing how you take Medicare is a big decision. It needs to be individualized, and we cannot go in depth there today. But we can get you around certain pitfalls though. And that is basically a question for enrolling on time. Here are the fundamentals for Medicare enrollment. This is the main principle. Unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. What if you do not enroll in Medicare on time? The consequences are pretty dire. First, you will be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it won't pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you are in poor health or you have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during the enrollment period. But if you don't, you go to apply for a private insurance later, you may not be able to get insurance or you may be charged a higher premium. So if you're receiving Social Security when you turn 65, you will automatically be enrolled in Parts A and B. If you are working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you will go ahead and accept Parts A and B, and your coverage will start on the first day of the month you turn 65. However, Parts C and D are not automatic. If you want a Medicare Advantage plan, you will have to contact insurance company offering it and sign for Part C through them. Or if you want to stay with the original Medicare and have a standalone Part D prescription drug plan, you will need to decide which insurance company's plan you want to go with, and you will have to proactively enroll. You should do this at the same time you are enrolled in Parts A and B before your 65th birthday. What if you are not receiving Social Security when you turn 65? More and more people are continuing to work or at least delaying the start of Social Security in order to receive higher benefit. In this case, you will need to proactively enroll in Medicare during the enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I will explain in a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. The initial enrollment period for people who are not covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. But although it lasts for a total 7 months, you really should plan to enroll in Medicare during the 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up a month. Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, your initial enrollment period starts February 1st. If you sign up during February, March, or April, your coverage would start May 1st. We have been talking about signing up for Medicare as a whole, but there are times when you need to break it into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts, not others. If you are still working when you turn 65, check with your benefit administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer group plan, when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at age 65. And the reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free for you, but check with your benefits administrator anyway. If your employer group plan is high deductible health plan paired with health saving account HSA, and if you want to keep contributing to your health saving account, you should not sign up for Part A. The reason actually is that once you enroll in Medicare, your HSA contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during the initial enrollment period at 65. So if you are not currently covered by an employer group plan when you turn 65, you will want to sign up for Part B during the initial enrollment period, preferably that 3 months period before your 65th birthday. So if you are not working, if you are self-employed, if you are employed by a company that has fewer than 20 employees, if you are on COBRA, even if you are receiving retiree health benefits, you will want to sign up for Parts A and B during the initial enrollment period. If you sign up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. Because if you go more than 63 days without prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better to just go ahead and get your drug coverage from the outset, even if you are not currently taking any prescription drugs. As I mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. Okay, that takes care of the initial enrollment period. Now we are going to talk about the special enrollment period. And this is for people who were covered by an employer group plan that covers 20 or more employees when they turn 65. And in this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you do not sign up during your special enrollment period. And the best time to sign up is before your current coverage ends, and that way you will have no gaps in coverage. But you actually have a grace period for several months to avoid the late enrollment penalties. For Part B, the grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. What if nobody ever told you about Medicare enrollment periods and you did not sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment period. Coverage starts the month after you enroll, so as you can see, this could leave you with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period. But it may be the only option for some people. And the most important thing to know is that you cannot just sign up for Medicare as soon as you realize you failed to do so. If you are outside the general enrollment period, you have to wait until the next one rolls around. Okay, let's do a quick review of Medicare enrollment periods. The initial enrollment period is for everyone age 65 who's not covered by an employer group plan that covers 20 or more employees. And the best time to sign up for this is 3 months before your 65th birthday. And then the Medicare coverage will start on the first of the month you turn 65. The special enrollment period is for everyone over 65 who is covered as a current worker or a spouse of a current worker under an employer group plan that covers 20 or more employees. And the best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first of the month of enrollment. However, the general enrollment period is for people who did not know that they need to sign up for Medicare during the initial or the special enrollment periods. They can sign up between January 1st and March 31st of each year, with the coverage starting the month after you enroll. So how do you sign up for Parts A and B? It's very easy. As I mentioned before, if you are already receiving Social Security when you turn 65, you will be automatically enrolled in Medicare. And if not, you can go to the Social Security website, ssa.gov, and click on Medicare, then click Apply for Medicare Benefits. Or you can do it by phone by calling the Social Security number. So Part D is not quite as straightforward because you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. And in either case, you will be shopping for plans offered by private insurers. Once you have decided on original Medicare versus the Medicare Advantage, and then chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare. Okay, this concludes our presentation for today. If you have any question about today's presentation, please give us a call. And for more information and timely updates, please follow us on social media and visit us at azzadasset.com. We hope you enjoyed today's presentation. Thanks again.